Hello, everyone. So, the World Heart Day is coming up, and today I'm going to tell you five numbers that you should know to assess your risk of heart disease. The first, your blood pressure. The blood pressure is basically the pressure with which your blood is pumped to your entire body. And now we all know there are blood pressure machines, whether it's automatic or you can take it manual like we did in the olden days. But you can check, it's important to check your blood pressure. A normal blood pressure number runs somewhere about 120 as the upper number and 80 is the lower number. So that's about a normal blood pressure. Anything more than that increases your risk of heart disease and blockages and other problems, and even strokes actually. So a blood pressure is the first number to remember. A normal blood pressure is 120 over 80. The second, your BMI. Your BMI is body mass index. The way you calculate it is you take your weight in kilograms and divide it by the square of your height in meters. A normal BMI is about 23 to 25, depending upon the ethnicity. Anything more means you're overweight or obese. The third number, it is your blood sugar. The blood sugar is, we check blood sugar by doing a small pinprick. It increases the risk of diabetes. If your blood sugar is high, that means you have an increased risk of diabetes or you are already diabetic, and that increases your risk of heart disease and heart problems. Your fasting blood sugar should be less than 100 because diabetes increases your risk of heart disease. The fourth number is your total cholesterol. It's important that if you have a family history of heart disease or you have diabetes or you have other risk factors, or even if you're more than 35 years of age, for example, then you should get your cholesterol checked every now and then and make sure your cholesterol parameters are within normal numbers. Your total cholesterol should be less than 200. A total cholesterol should be less than 200. That is normal, and that reduces your risk of heart disease. A high total cholesterol increases the risk of heart disease. The fifth and final number, that is your HDL. HDL is the good cholesterol in your body. That is also done by a blood work. You, you can get it done at any lab. And when you get a lipid panel, which we order, your HDL cholesterol comes as a separate value. Your HDL cholesterol is it's low if it's less than 40, and that means your good cholesterol is low, and that increases the risk of heart disease. It's important to measure these five numbers every now and then if you have a family history of heart disease, or if you have already heart disease, or even if you're more than 35 and you want to check your risk of heart disease, then keep an eye on these five numbers.